All right. For those that you are new, I see there's some new faces on here. Understand everybody is muted, so we chat questions in. Use your chat if you have questions that you weren't able to get in from the member site. The best way to get questions in is you ask them on the member site. In just about every one of the pages, you can ask a question. Ask a Zoom call question box is on that site. But sometimes things come pop in your mind as we're going through this, and it's a good time to ask a question. So feel free to chat that in. We usually spend about an hour. Sometimes it's less, sometimes it's more. But let's get started. All right, and we'll get to the chat questions at the end after we get through all the other questions. A reminder to always go to the members site for your initial announcements, any changes, any updates, anything. I'll put it on the member site on the home page. So this is from the home page from just a little bit ago. And there's a couple announcements. The binder Zoom calls. Don't think it pertains to anybody on the call today. Are going to be one-on-one for the next few weeks. Everybody has access to the courses. I've said that already. And we talked about the PDF from Dr. McCullough about the recipe for nebulizing hydrogen peroxide. There's a question later, so we'll discuss that. And this is something a little bit new right here. We need to ask everyone to please only ask questions via the member site. Well, I just discussed the little box saying, ask your Zoom call questions here. Of course, you can chat them in on the Zoom call, but I'm talking about as opposed to emailing questions. There are some legal issues with emailing answers. So we need to, so I hope nobody's offended if you forget and you email a question in, because you're going to get an answer that says, please, we'll answer this on the Zoom call. We have to do that. There's just some, we just have to stay safe in everything that we do. Here's the courses. If you go on the courses page on the website, the different courses that you have access to, that could be very helpful for you. Question number one, the Rife bulb. Just want to confirm you leave it in the plastic tube and you don't take it out. Yes, you don't take it out of the plastic tube. Absolutely not. You will avoid the warranty and you'll be buying a new bulb. So do not take it out of the plastic tube. Yes, correct. Please go to the member site, look on the Rife page. You'll see a whole bunch of the Rife questions answered on there too. So make sure you're utilizing the member site the best you possibly can. My oncologist suggested that I increase my B vitamins to help build back my red blood cells following chemo last year. I also take beef liver capsules. My multivitamin, MitoCore, I take 1 rather than the suggested 4. It also has B vitamins. For a few months, I took extra Bs, their encapsulation B complex. I opened the capsules and took 1/2 or 1/3 of them, and my latest lab did not show any improvement. Excuse me, my latest lab did show some improvement. On last week's Zoom call, you mentioned that cancer patients don't need too many methyl groups. Hopefully I got that right. Yes, you did. If I am in remission, does that still apply? Would you suggest taking extra B complex or not? Yes, I said if you're in remission and you're dealing with low hemoglobin, or especially if you're dealing with high homocysteine levels. So homocysteine is a product of the methionine cycle, and homocysteine is a metabolic midpoint metabolite, meaning that it isn't necessarily, it's kind of a bad guy in too high of concentrations in our body. It's not supposed to stay in too high of concentrations because it's supposed to be converted to downstream metabolite that is less dangerous, and it's dependent upon the B vitamins and folate in order for it to convert. So a person that is deficient in folate and some of the B vitamins can have high homocysteine, and that's the most dangerous thing for heart disease. So if your homocysteine is high, then you do need to take more Bs, and you can even take some methylated Bs for that sake. Certainly, if you're in remission, you don't really need, this doesn't necessarily apply to you. Even if you don't have high homocysteine, you can still certainly take methyl Bs. Do you have anti-neoplastin therapy at Cutter's Clinic? No, that's only available through Dr. Brzezinski in Houston, Texas. Would that be an intelligent choice for stage 4 breast cancer metastasized to the brain, lungs, and liver? You'd have to consult with them. I'm not a specialist in that. That's what he does. Do you provide thermoablation at Cutter's Clinic? No, we don't provide any invasive therapies like that. No. I've noticed that my foot bath watercolor has turned from a caramel brown to a much darker gray black color. It has been this color ever since I got my new foot bath machine. Does this have anything to do with a rise in my CA19 numbers? If not, what does it mean? So the colors in your foot bath, I have a video about that I don't put a lot of credence on the colors that you might Google and say, oh, well, this means it's coming from my liver, or this means it's coming from this, or whatever. I don't put a lot of credence in that. The only time you want to really be concerned with the color is the lack thereof. If you have no discoloration change when you do your foot bath, then you have to question whether you need to replace your ion flow wave. And it should not have anything to do with the rise of your CA19 numbers, no. So the darker color is just fine. You wanted a darker color. It could be a caramel brown to a darker color. If it's just clear after you do your foot bath, then you need to replace your ion folate. I've been reading the book, How to Starve Your Cancer, and I've only gotten halfway through. Do you agree with what she's purporting in the book in terms of all the drugs and protocols she suggests? This is Jane McClellan's book. With my recent rise in tumor markers, I'm getting nervous all over and continue to look for answers. So yes, a lot of her things, we have some of our members that are using some of the protocols, not all of them. And some of them make sense. So you can go through, you could Google Care Oncology. That's who all of our other members are going through to use those protocols, and you can pick and choose what you want to do. Some of them seem to be for different cancers, seem to make a little bit less sense, but some of them can make a lot of sense, and that can be another approach that you can take. And there's no change in what we would do. You would do with the nutritional approach. You could just add those to your approach as well. My primary diet is juicy. Is it normal to hear gurgling in my stomach all day? Or is this indicating something I need to be aware of? So gurgling in your stomach all day can be due to a need for hydrochloric acid and digestive enzymes. So it might be good to take some HCl Zyme. HCl-XYM is the product I'm talking about. It's HCl, hydrochloric acid, which is needed in your stomach, and digestive enzymes, which is needed in your stomach and your first part of your intestines. Juicing, though it's pre-digesting things, it's breaking it down into smaller particles, it's still raw. And raw food is difficult to digest, and it can cause some gurgling in your intestinal tract. So if the gurgling is more in your intestinal tract, then digestive enzymes would be the thing that you would help support that. And understand, gurgling in your stomach doesn't mean it's a problem. It doesn't mean it's an issue at all. It's not necessarily an indication of really anything. So unless you're having some other digestive issues, I don't know that I would even, think that you need to go and take a bunch of different stuff. I would continue on your protocol. Would ultraviolet blood irradiation therapy be useful in preventing metastasis or other anti-cancer benefits? If so, is this procedure that is usually prescribed by MDs? So no, it's not usually prescribed by any oncologists. It's more of a alternative therapy. I personally don't know any clinics in the Midwest that do this therapy. Yeah, you'd have to look around that do it. Is it beneficial? It can be. I mean, there can be benefit to it. But again, you're radiating the blood or you're ozonating the blood. You're just taking it out. You have a portal in one arm and another, and it's going through a machine and it's going right through your body like that. That's how that machine works. To me, that makes more sense for pathogen therapy like Lyme disease and things than it does so for cancer. But I know that there are the doctors that do have the machines are doing it for cancer too. So you'll have to look into that. I don't do that. So are there any concerns about doing too much of a good thing? I currently use Nightly Rife machine, the True Rife Ion Foot Soaks 6 days per week. The Beamer PEMF, 8 minutes twice a day. Supplements, jump on a mini tramp, walk 30 minutes a day. Diet is okay, but could improve. I don't see any of those as being too much. Maybe you certainly, if you're doing well, what would I cut out of this protocol right here first? I would probably cut the Ion Pro Waves down. If you're not doing well, if you're doing poorly, I would continue this protocol. But if you're doing really well, I would cut out that thing that takes the most time, and I would cut out the Ion Pro Wave. The walking, the exercise, of course, takes time, but that's something you really need to keep doing. So here are my blood results taken yesterday. Not what I wanted to see. Any suggestions from here? One question: does detox using supplements, Food Rife, Ion Pro Wave, Castor Oil Packs, etc., increase the numbers 6 months out from chemo? So I did write down this person's blood work, what was elevated, the AST, the alkaline phosphatase, and the CEA. But I did notice that we didn't have any data on past numbers for this person. So I can't make a comparison. So I'm assuming that this person is saying that these weren't elevated prior to this test, or they're at a higher level than they were 6 months ago. But let's talk about that. An elevated AST indicates liver issues, but it's not specific. So it's not a specific test like, oh, you have fatty liver disease. It just elevated AST is a liver enzyme, and that will be elevated if you have liver congestion. Could it be metastasis in the liver? Well, it can be elevated with metastasis in the liver, but a lot of people have AST elevations and no metastasis in the liver, and they don't even have cancer. It has nothing to do with cancer in its raw form. It could be completely independent. CEA is a tumor marker. So if CEA is elevated from prior, then that's a concern because that's an elevated tumor marker. So if your tumor marker goes up, again, you don't take one test by itself, you measure it with other signs and symptoms and other objective findings. So if let's say you did a CT scan and the tumor shrunk, but the CEA, it went up, you did a PET scan and there's no new signs of any metastasis, but the CEA went up, well, then you might just ignore that CEA test in a sense. You put it in the back in your back pocket, and you might look at other objective tests. Again, I don't have a baseline of where the CEA was, and if you don't have a baseline of the CEA and it's elevated above normal, you have no idea what it was before. Maybe it was much higher. So you compare the data of a test to the previous test. Well, this is my first one. Okay, well, then it just, you already know you have cancer, so it's very common to have an elevated tumor marker like CEA, which is fairly broad tumor marker. if you have cancer. So if you don't have anything to compare it to, it's, it's a moot point. Now we got a baseline. So alkaline phosphatase is a totally different animal. So alkaline phosphatase is another liver enzyme, but it's not. So it can be elevated if there's congestion in the liver, if there's toxicity in the liver, if there's metastasis in the liver. But a common reason why alkaline phosphatase is elevated with people that have a previous cancer diagnosis is metastasis to bone. So your oncologist should be looking for that. If you see alkaline phosphatase be elevated with a patient that has a diagnosis of cancer, you should be looking at bone. So how do you look at bone? You do a bone scan, you can do a PET scan. You do a CT scan if the person has, CT scans are regional. So the issue with that is you don't want to do whole body regional CT scans. So then you limit your CT scan. If the person had, let's say, they had screaming low back pain, you do a CT scan, it's better scan to visualize the bone than an MRI. So you do a CT scan of the lumbar spine or the low back or the lower abdominal area, and you'd make sure that there isn't any bony metastasis. Because if there is lytic metastasis, meaning that bone is being eroded away, which is the most common type of bony metastasis for any type of cancer, is a lytic metastasis, not a blastic metastasis, which is lay down of bone. So you got a bony erosion. It gives off, it elevates your alkaline phosphatase. So not to concern you, but you got to be a realist. You got to go, okay, I've got elevated alkaline phosphatase. Your oncologist should be going, we need to be looking and making sure that there's no bony metastasis. And then if you do find bony metastasis and then you're working at treating it, then you will, and you're successful at it, you will see you will see the alkaline phosphatase go down. I actually had a consult with somebody the other day that was exactly the case. His alkaline phosphatase dropped back down to normal. So it's great news. I've started in past couple of weeks with right-sided heaviness. Food doesn't have the same flavor. I'm not fully understanding this question, so make sure as best you guys possibly can is to word your questions in a way so that I could determine what you're really talking about. Right-sided heaviness, I'm thinking you're talking about abdominal heaviness after eating, if you're talking about food. And you really want to make sure you're not constipated. Make sure you're emptying your bowels every day. Food doesn't have the same flavor, is very different. So the taste of food might be related to a viral infection. It's very common. You have a bad cold or some sort of viral infection that you can lose your sense of taste, especially if it's some sort of respiratory infection or if it's in your sinuses. I think that's the best I can answer that question. Question with Dr. Mercola's formula for lung infection: how many times a day do you think I should nebulize? So this person is talking about this thing. I put the PDF of Dr. Mercola, the recipe for his nebulized hydrogen peroxide to help heal the lungs, because the last few Zoom calls we had questions about issues with lungs, respiratory issues, fungal infections in the lungs, etc. Nebulized hydrogen peroxide and nebulizing other things can be very beneficial. You can nebulize colloidal silver. You could put a drop of essential oil in with the hydrogen peroxide or colloidal silver. That's, again, you're getting whatever you're trying to do. So again, hydrogen peroxide is a great topical antiseptic. Why? Because H2O2 is hydrogen peroxide, and it can easily give up an oxygen-free radical. That can be a danger of consuming hydrogen peroxide orally. because oxygen-free radicals are free or oxygen radical species that can damage cells and actually be a cause of cancer. But in a topical setting, it actually kills bacteria because it'll attach to bacteria and viruses and fungus and it will kill them. So that's what makes it a great antiseptic. So when you're nebulizing, it's a great antiseptic for things in your lung. Now, if I just have really weak lungs and it has nothing to do with fungus and it has nothing to do with any type of bacterial infection or viral infection, but maybe it's asthma or maybe it's an allergy, then hydrogen peroxide would not be the thing that I would nebulize. You nebulize hydrogen peroxide if you think it's some sort of pathogen, some sort of infection, which is very common with cancer. So that's why we talked about that. But if it's allergies and it's a histamine issue and a mast cell issue, I wouldn't be nebulizing hydrogen peroxide. So there's other choices, but that's not what we're talking about. How many times a day you can do this? You can do this 4 or 5 times a day until you feel better. My wife does this a lot because she has major issues with her lungs from when she was a child and put on medications, and her parents were not naturally minded at all. And this, I tell you, nebulizing hydrogen peroxide and other things helps her the more than anything. So good choices. I've been listening to a lot of your lymph recordings and wondering if you could explain a bit more. I have a lymph node under my right arm that they biopsied and it showed cancer. By the end of the day, sometimes it is very sore and large, but goes down overnight. This last week, it started on the left side. I understand that they are our body's car wash, but at what point do they start to clear up or swelling go down? Well, your lymph nodes will increase in size if there's an infection. If you have blockage in the lymph node because you have some cancer growing in the lymph node, then it will increase in size at different times simply because fluid goes through there. So remember, your lymph system is like an open-ended capillary system. It is an open-ended capillary system. And I liken it to, I have several videos on the lymph system on the member site. So do look at those, but it's like your storm sewers in your street. So if your street floods, you have 10 inches of rain overnight, the water has to go somewhere and it's rinsing down to the storm sewers. Well, if you have blockage in that sewer in the street, it's going to back up. And that's what could happen if you have tumor cells in the lymph node, and then you're gonna notice the swelling, you're gonna notice swelling around that lymph node, you're gonna notice some lack of drainage. But normally, if there's a horrible rainstorm, they will sewers can back up because of that. And that's where, like, if you have a horrible infection, your lymph nodes can get larger. And then they will go back down. That's called lymph node hypertrophy. And then they do go back down. You probably notice this with your children. If you have kids, they're sick or something and they have swollen lymph nodes. Well, they're not really swollen. They're hypertrophy to try to kill an infection. So, and then they will go back down. So the lymph nodes themselves are where the drainage tube of whatever area is being drained goes through, and it's a conglomeration of different white blood cells to be able to kill anything because it drains back into the blood system. And we certainly don't just want the extracellular spaces, the spaces around your cells, the fluid to go into the storm sewers, and we're going to put it back in the bloodstream. Normally, your storm sewers are going to, that's like putting your storm sewers down to the river. You're just polluting the river. Well, that wasn't a good idea when they decided to do that 100 years ago, so they're changing those things. Well, our storm sewers are going right back into our river, our bloodstream, but they have a filtration system which kills any pathogens called your lymph nodes. So that's what your lymph nodes do. They filter this out so it kills any pathogens. So you're not actually causing a systemic infection. What do you recommend for pain management? I've had severe joint pain, long COVID, I'm sure. I've been using Clear Inflam. I take 3 to 4 capsules, 3 to 4 times a day. Is there something else that would work? So you are taking really the right dosage of that. So Clear Inflam is a lot of the flavonoids, curcumin, boswellia, resveratrol, green tea extract. I think, if I remember correctly, I think stinging nettle is in there. There is a product called it's an Evolve product called Limitless, Evolve Limitless. That can help. That's a Betalin, and it's a patented process where they take Betalin, which is an enzyme from the liver that is the extremely anti-inflammatory enzyme that can really help with pain. There's a lot of testimonials on Limitless. So Limitless comes in a box. The capsules are sealed, and just take a couple of those a day. Limitless by Aloe Vera. Would you recommend that all cancer patients take B17? No. Or would their genetics indicate? No. This protocol was not recommended to me by you, but I have recently begun to take Apricot Power B17 in a protocol that works up to high doses. I have fungating tumors. I have fungating tumors. Is there any information available that shows that B17 would be beneficial to reduce or healing these tumors or the wounds they create? I don't know. It's going to be really hard. You have to use DuckDuckGo or something to search for resources on B17 because that's Laetrile, and Laetrile is something that has been just shut down by Google. So I do have information on my website, but I don't have anything specific on what you're talking about there. So we'll have to use an alternate search engine to search for that. I'm missing eating chips. Is it okay for me to eat Siete grain-free tortilla chips? Yep, I'm familiar with them. Yes, you can eat them. Can you eat the whole bag? Sure, but just not in one sitting. Can I use ozone far infrared every day? Yes, I would say. Yep. Is lard okay to use as fat once in a while? Yes. Yep. I would say yes. Just got my genetic test results in today. Can you do a phone conference versus watching the video to go over it? No, we can't. We get on the genetic Q&A on Thursday, and we can go over a few things with it. Oh no, we can't. I can't do it this Thursday. Be next Thursday. So next Thursday, the genetic Q&A is when we could go over it. That would be the most appropriate way to do it. I am new to the program and starting to detox. I could taste metal in my mouth. I think I did a no-no and opened a coconut charcoal pill to rinse my mouth, and I accidentally inhaled some charcoal. Can I clear that out of my lungs? I am very worried. Yeah, I don't think there's any harm in that. I don't think that you're gonna have to worry about that. If you do absorb any of that through the alveolar spaces, there's no harm in charcoal and bead in your bloodstream. You'll filter that out, so I wouldn't worry about that. If you feel like something's in your lungs and you're coughing and stuff, you just don't want it to cause infection. Hey, what do you do for that? You go back to nebulized hydrogen peroxide. Sorry, I mixed the charcoal in a glass of water to be more specific. Yeah, that could happen, I know. And that'd be the same thing if you were breathing in anything, you're out in a dust storm, or people that live near the desert and these wind storms that could cause red tide issues, that you're living near the ocean. You got these fungal type things that could cause a lot of infections, and people don't realize, you think you're eating things bad, that's how it gets into your system and causes problems. Certainly injecting things is the fastest way to get a toxin in your system. But actually, the second fastest way to get toxin in your system is breathing it. So we damage our lungs more than we think. And so there can be little hidden infections going on in your lungs that you don't even know about. So I'm a big fan of nebulized things. B vitamins that you recommend for those with cancer. Yes, we talked about that last week and the week before. That would be the B specific naturally. So the B specific naturally is a product that is first of all, it's whole food, and a whole food bee is important because synthetic bees are not the greatest things for us. But it's also lower in the methylated products. It does have methyl B12 in it, but it's a lower dosage, not high doses of methyl groups. You don't have the methyl groups that can silence tumor suppressor genes. So be specific naturally. It's my professional health products. Do our cheek swabs that we send in show energetically whether cancer is still present or not? Yeah, we can't legally say that or not. So, we are just, we coming under more and more scrutiny by the powers that be. They're trying to destroy us every way, shape, and form. That's why we ask for your prayers. And we can't say anymore that whether cancer is coming up or not, or even energetically. We got to be just so careful on anything that we word. They're just trying to destroy us constantly. So it's just a constant battle. I had pneumonia and I'm still having chest pain, but lungs are clear. Okay, so stop right there. Well, let me finish. Doctor gave me an inhaler, but have been doing Dr. Mercola's protocol instead. Which one could be better? Well, I have no idea what the inhaler is. Is it an antibiotic, or is it some sort of just steroid to open up your lung spaces? Certainly, if a person is having issues like I feel like I can even catch my breath, you want to take medication. So a drug that will open up those pathways can save your life. You don't want to play around with that. But a steroid type drug that's going to open up pathways isn't going to do anything to kill any residual infection. And just because your X-ray, so they do say I haven't had pneumonia with my chest. I have chest pain, but my lungs are clear. That sounds like radiology terminology. So a radiologist would look at an X-ray and say, "Oh, your lungs are clear," meaning that you don't have any infection. Well, just because you can't see it on an X-ray doesn't mean you don't have lingering infection, or you have bacteria or viral or fungi that are still harboring and causing issues. So it's great that it's not present on an X-ray, but just because it's not present on an X-ray, it's not me. Person can have full-blown pneumonia, and you can't see it on an X-ray. So you still treat it if you're having symptoms. Treat the symptoms. So and then which would be better? You could do both. So is methylene blue photodynamic therapy okay for me? Yeah, I would say yes. Is your TumeroClear the same as orthomolecular Turiva? Yes, it's the same thing. Our TumeroClear is their Turiva that we private label. They private label it for us. So they print the labels and everything. Yep. Brio is the inhaler, Doctor, just listen to your lungs. Okay. Yeah. Are you familiar? So understand, when you give me a drug, when you guys ask me a question, should I take this drug or not? I can't answer that question. So you can ask the question, but I'm gonna have to say I can't answer that question. Sorry. So, but I can help reason through things with you. I mean, let's just talk about it, reason these things through. Are you familiar with SEACT? Yes, yep. And we have SEACT at our store. We have I have multiple articles about SEACT. I write about SEAC and Renee Casey in my book. Great herbal things. Does the heat of infrared heating pad or any other heat increase blood flow? Yes, it does. Isn't that bad for cancer? No, it's not. So you don't want, when you talk about increased blood flow to cancer, you're talking about, you don't want increased growth of blood vessels in the tumor. So first of all, we're not talking about any of the blood cancers here. We're not talking about multiple myeloma or any of the leukemias. We're talking about hard tumors. So hard tumor is a tumor that is a mass, some kind. So we don't want to allow increase of growth of blood vessels into the tumor, because that is what will bring food and feed the tumor. So heat is not going to do that. Heat will increase blood flow in around the tumor, which actually can help in ways, and tumors do not like heat. That's the whole idea of hyperthermia. So hyperthermia is another cancer therapy that increases the heat deep. So a heating pad is only going to increase the heat like maybe, 4 millimeters deep, in your skin. It can, cause some burning of the dermis and epidermis layers, but it's not going to cause really a whole lot more than that. But it will warm up. I mean, as far as damaging heat, it will warm up other things. That's why I think heat over the liver can be good. But when this person showed me a picture of what they happened with using infrared heat, that's what I was concerned about. Using it overnight, you could burn yourself really easy and not even notice it. So just be careful with that. Oh, say I use heat overnight. Lots of times if I have like a chest cold or my back is hurting or something like that, I'll use the infrared heating pad, the one with the little stones on it. And but I'll just make sure that it's turned down. And I usually wear, it's over a shirt or something between that and my body or something like that too. So, because you fall asleep, you could be in a deep sleep, but you could burn yourself and you don't even know it. So, is there a new circulating tumor test within the United States that is new and our doctors can order? I thought you mentioned one a few months ago. No. So there are circulating tumor tests, and I don't think you're asking the right question. I'm not in favor of doing circulating tumor tests. There's lots of circulating tumor tests you can run. But to me, there's no value in measuring circulating tumor cells. To me, there's no value at all. You're taking a blood sample and say, are there any circulating tumor cells in there? Well, what to do? What do you care? Your tumor is giving off circulating tumor cells at some point in time. And the ones that are circulating in your blood, if there are any, that doesn't give us any, it doesn't help us in the cause of care. So you just have to assume you have circulating tumor cells in the tissue somewhere. That's why even if you get a full clean bill of cancer, you still keep doing your right and still keep doing your stuff, because darn well that you're a realist. You're not, this screaming optimist, and you're not a negative person, but you're a realist. You're like, okay, well, I'm sure I got cancer cells somewhere, so I got to continue doing this stuff so it doesn't just take off and raise a family of a million kids and now we got a problem. So I don't think there's any value in doing a circulating tumor cells test. So if your question is really about other tests that can measure whether there's cancer growth or not, there isn't anything. You certainly can do watch that video on the member site. How do I know if I'm improving? There are tumor suppressor or tumor marker tests that a person could do if those show positive, and other things that you can do to measure success or not. Can the right be used for AFib? If a person has AFib, I don't know that there's settings. If there's a program for AFib, there's certainly heart settings on the right. So if a person has heart issues, you can look. I don't know if there's AFib settings. I'd have to look. But there's other things that could be done for AFib. Many times AFib has to do with vitamin D deficiency. Yeah, so I'm assuming this isn't you. But certainly you can look on the right for the alphabetical listings under heart, or if it is under A. Should I use red light therapy for anything related to my protocol or just for inflammation? Someone suggested I go to Planet Fitness to use their red light pods. Is this sufficient? Is there any real benefit for cancer patients? Light therapy, that is just the red light therapy and green light therapy and blue light therapy, are just in a very distinct spectrum. It can have some benefits for skin issues. It can have some benefits for inflammation that is more surface inflammation, help with some pain issues. You're just going to try that yourself. It's certainly give it a try and see. Is it going to be beneficial to help heal a person's cancer? I would say no, not at all. Can it help with other comorbidities? Yes, for sure. So I think that's worth trying for those kind of things. Is there a supplement that could possibly thin the blood? Yeah, there's supplements that can thin the blood. That you do have to be careful on. If you're on a blood thinner, then you do have to be careful with supplements that could thin the blood too much, and you end up with bruising and stuff like that. Your number one blood thinning supplement is garlic by far. So years ago, I have had a lot of heart patients. I actually have on the blogs multiple blog posts about cardiovascular health. Matter of fact, we're going to have a course on cardiovascular health. Probably won't be done till after the first of the year. But garlic is your number one blood thinning nutrient. There's some blood thinning benefits with fish oils, but garlic is far superior. But again, just like with anything else, you don't just want to treat the symptom, you want to treat the cause. With cardiovascular especially, there's a lot of underlying cause to cardiovascular disorders. Most of the time it has to do with either a toxin or a biotoxin that gets under the layer of the epithelium. The epithelial layer of the blood vessels is called endothelial cells. You can have a toxin or a biotoxin get under the endothelial cell and affect the different receptors in the smooth muscles. So you have these smooth muscles that wrap around the vessels that function to increase or decrease blood pressure. Why would we want to increase blood pressure? You have to increase blood pressure. When you even stand from a sitting position, your blood pressure has to go up about 10 to 20 points, or you will pass out. You have to be able to shunt blood to your brain instantaneously. And that's a hormonal reaction. It has to do partly with the neurological sympathetic system as well, but mainly hormonal. And so there's a lot of different things that can block the different receptors. You've heard of like ACE2 drugs. Those are blocking the ACE2 receptors. Well, green tea extract is one of the most potent beneficial ACE2 receptor antagonists that can be really beneficial for a person. So is resveratrol. There's just a plethora of different things. I do write about a lot of that on the blog posts that I have on cardiovascular. Does the clinic still order labs as mentioned in the how do I know if I'm making progress video? Yes and no. So again, we are just under a lot of scrutiny, so we have to just be careful on what we do. It's the state of Minnesota, even though we're not in Minnesota anymore. But it's so we'd rather have you get labs through your local functional medicine practitioner. That would be safer for us. So we ask that you try to find somebody local that you can order those labs. We can certainly guide you in what labs you should order. But kind of easy because all you got to do is go on our website and go to the blog post on tumor markers. And depending on what cancer you have, then you pick those tumor marker tests. So they're fairly inexpensive to run tumor marker tests, so they can be valuable to run. Even at that, if you do have an oncologist you're still working with, I would ask them first, because if you have insurance, it'll be covered under your insurance. They are standard medical tests. The tests that we do run, and we can run from a medical legal standpoint, are functional medicine tests. So Cyrex tests, food panel tests, antibody tests, things like that are all within our realm of running. We can run other tests, but we'd really rather have you get like tumor marker tests done locally. And if you can get them covered by insurance, I mean, your insurance will cover that kind of stuff. But all you gotta do is look at that blog on tumor markers, and it's pretty easy to figure out what tumor marker test to run. But unfortunately, if you have breast cancer, just running most breast cancers will show positive tumor markers. So then you can use it as an indicator. But if you have a cancer like melanoma, you're not going to show any tumor markers. So, you can't do any of those labs. If you have, pancreatic cancer, your CA19 will show, and you can use that one most likely. If you have colon cancer, rectal cancer, abdominal cancer, the CEA might be positive, the CA125 might be positive. So you can run those inexpensive tests to see if they show. If they're all within normal range, then you can't even really use any of them. And that's not, we can have a stage 4 patient that they don't show any tumor markers. So then it's kind of like, oh, well, that's not very good. Well, at least you can't use it as a marker. You can't use it as a marker whether you're getting better or worse. I just got my vitamin D level back and it is 81.7. Is this high enough or you use suggestible? That's a good range. You really want, I think the medical range depends on the lab that's running it. The normal is like 30 to 60. It depends on the lab that's running it. 30 to 80, some other labs. I really want my patients to be like, 70, 80 to 150. So if you're taking vitamin D, I'd keep taking vitamin D. Your medical doctor might go, oh my gosh, it's 81. You need to stop taking vitamin D. Well, we say, okay, thank you. And then just keep taking your vitamin D. I never got tumor marker tests, just CTs, MRIs, etc. Is there any use getting them now that I've started my program? Yeah, the reason why oncologists typically don't run tumor marker tests is they're coming from the perspective that you are going to do what they're asking them to do. So they're asking you to do chemotherapy usually. And the negative about running tumor marker tests is tumor markers can spike if you're doing tumor chemotherapy, and then patients freak out. So your CA19-9 with breast cancer, especially, let's say your CA15-3 with breast cancer, was high abnormal at 45, and you start doing chemotherapy, and it jumps up to 150, and the patient freaks out, and the doctor's got to talk them off the roof because tell them that it's normal for it to spike during chemotherapy. Well, oncologists got to the point of, well, we're just not even doing these tests because I don't want to explain that to people. So they just stop. Most oncologists stop running tumor marker tests. You have to ask for it. So I don't suggest doing tumor marker tests if you're going to do chemotherapy because it skews the test. But if you're not doing chemotherapy, and you want a non-invasive way to test for progress or lack thereof, you can get a tumor marker test. So again, look at our website, search the website for tumor marker, and you'll see the blog. It has tumor marker tests. There's about 5 of them that should be run for breast cancer, because you don't know which one will be elevated, maybe all of them, maybe only one of them. So that's the thing to do with breast cancer. So breast cancer's most common reason why you use tumor markers. Should my swab test also have a review of my Rife frequencies after an increase in markers? We can do that. We can look at that with your type of cancer. There, with anybody's cancer, it may or may not show that we're going to change your frequency. So just know, if you don't get a flash drive from you, we didn't change your frequencies. Thoughts on soy? Dr. Christy Funk says they're okay because of phytoestrogen, but I could be wrong. So I am not a fan of soy at all, especially if you have any cancer that could be remotely influenced by hormones. So if you're talking about soy, eating tofu, having something with soy in it, that's what I mean by I'm not a fan. If you're taking a specific phytoestrogen to balance your estrogens, let's say you're in total remission, and now you're having these horrible hot flashes, being careful and gentle with that. I don't think there's a problem. I think that's probably what Dr. Christie is talking about. The phytoestrogen that is removed from the soy in a specific product. Typically, you'd see those in nutritional products that are meant for women going through menopause. So if you are in active cancer, I would probably shy away from those. Sometimes we have given those to women if they tested fine, but most of the time they do not. If you're talking about eating soy, I would totally shy away from that. It's very hard to find any organic, non-GMO soy. Soy is very much an estrogen stimulator, and there's just a lot of bad players in soy. Plus, it's almost all the soy that you get in the United States is GMO, and that is a huge issue right there. So I would stay away from soy if I were you. Okay, I think I have lost my voice for tonight. So just a reminder, if you jumped on late, please address all your questions through the member site and not emails to Ann or Ashley or myself. I'm not trying to be mean, but I got to stop answering, and I'm the one that does more than answering, myself and Ann. We got to stop answering those emails for just medical legal reasons. We have to keep it to a group educational forum like this. We can be safe doing what we're doing right now. This is exactly how we want to be answering questions. So get specific on your questions. That would be the next point. I should put that in what's new here. Please get specific on your questions so we can understand them, and not trying to guess what you're really talking about. So, and then I keep people's names off the questions. And by doing that, I don't remember who asked the question. So you might want to put in there, like many people do, they say something and then they say, I have breast cancer or something. So like I think this person said with pancreatic cancer. So that helps answer the question, because with different cancers, the question is going to be answered different. So thanks again for all you do. Keep praying for Ann and her son AJ. If you haven't heard, her 19-year-old son was diagnosed with acute myeloid leukemia. he started chemo 2 weeks ago. He's at a point where his white blood cells like down to nothing. Still in the hospital. Not a happy camper, 19-year-old, wants to go home. And but boy, he was just awfully sick. So be praying for him. He has a bone marrow biopsy tomorrow morning at 9 o'clock. And I told him that I just ask everybody to be praying for him tomorrow morning that biopsy comes out good and clean. So appreciate all your prayers. All right. Thank you guys again. I'll be praying for you. Know that I love you and I pray for you guys every day. And I ask that you just keep praying for us too. Appreciate all you do. Talk to you on Monday. Bye-bye.